Our final speaker today is Ian Anderson. Ian is a recent master's graduate from Simon Fraser University's Public Health or Public Policy program, where he focused on international health of marginalized populations. His research was specifically in barriers to health access for sex workers in Malawi. He is currently a project coordinator for HIM's community consultation, and his presentation is entitled "Is HIV All There Is? Assessing Health Needs of Gay and MSM Using a Formative Community Consultation Approach." Please welcome Ian. Thanks.
All right, thank you very much. Just on first glance, it looks like my slides are not the way that they were on my computer, so I apologize for any future problems with that. Bracket's not supposed to be up there. So I'm here. I'm going to be presenting on the community consultation, just focusing mostly on the methods, and then at the end I'll talk a little bit about some of the response we've had to the consultation. I was hired basically when I graduated back in June at HIM to coordinate this consultation, with the overall objective of sort of being able to describe the populations and communities of gay men and men who have sex with men in Vancouver. And I think it's really exciting that I'm following some of the discussion that happened this morning around gay men and men who have sex with men, because I think that was something that was really important to talk about, especially when we're sort of parsing these populations into two groups and recognizing that there is a lot of overlap. And I would also posit too that in the community of gay men, that is not just one, of course, homogeneous community. So, just as a bit of project background, I think we've sort of all recognized in a lot of the presentations that there's in some ways a surprising lack of knowledge around describing communities and populations of gay men and other men who have sex with men. Of course, the rhetoric too around gay men's health has been dominated predominantly in the HIV discourse, which, although is important as we're well aware, is not the only component to achieving the health and well-being of gay men. I think when we think about describing these communities and populations, a lot of us can refer to and lean on sort of anecdotal evidence of saying oh yeah, there's the gay community in the West End, or there's populations that are coming up in East Van, or that they're married guys who are having sex in the park. And I think having a project like this allows us to capture some of that in people's real voices, and actually going to the populations to hear what they have to say too. Of course, there's work being done in Vancouver around some of these areas, of course, and I'll just point to, of course, the Sex Now survey that's been going on for the past 10 years. That's given a lot of data on, of course, not just Vancouver but across Canada. But also the Man Count survey that was out last year, and that was there were copies available here. That was mostly venue-based recruitment, but very useful in sort of informing some of the questions that we were going to ask in this community consultation, especially around health information and accessing health services. So motivation, rearrange my slides here. So again, I'll just sort of introduce the Health Initiative for Men briefly for those of you who may not be from Vancouver. HIM's mission statement is to strengthen the health and well-being of gay men, and the organization does this through 4 program areas: the physical health, the sexual health, social health, and mental health. And there's a huge contingent of HIM guys here, and I'm sure you've talked to some of them or have heard of some of these program areas already. HIM is kind of uniquely positioned in Vancouver because it is one of the few organizations that's dealing with health of gay men. But of course, recognizing that, like I was mentioning before, that the other men who have sex with men, these are not sort of airtight categories, and that there's a lot of overlap there's a lot of overlap, and this, of course, impacts each other's health, and it means too that him and other organizations that are working with gay men's health have resources that could help this population or these communities of other men who have sex with men as well. So, so him in Vancouver anyway is sort of uniquely positioned as a central point to then move out in terms of a project like this. So we took a community consultation model, and I sort of used community consultation a little bit loosely here, in that what we were trying to do was engage with the communities and populations, and then develop a report and sort of different ways to feedback, this being one of them, that we can then, that him and other health-related organizations in Vancouver and agencies can then feed back into programming and services for these community and populations. And that could just mean information sharing, it could be actually developing specific projects. So the specific objectives of our consultation was, like I mentioned before, and this was really the main one, was to look at who the populations and communities of gay men and men who have sex with men in Vancouver are. Once looking at that, looking at some of the sexual and social behaviors that they're engaging in. An important question we wanted to know too is where sex is being negotiated, and does that differ when we're looking at different populations and communities? And again, how they're getting health information. And then sort of that overall question at the end is like, how can we then better serve them as either him or recommending to other organizations as well? So we started off by identifying some initial sort of subdivisions of the populations, and this was an exercise that we undertook at him, but also consultation with the literature and other organizations, with an intention to be an iterative process and really not exhaustive. And so we were looking at traditional sort of demographic categories, ethnic backgrounds, whether they're immigrants or not, age spectra, but also like how people identify within the gay community, and a little bit around how the behaviors that they engage in too, i.e. like where people are meeting for casual sex. So in developing like how we were going to reach these guys, we borrowed a lot from the literature. Studies looking at HIV vulnerability to hard-to-reach populations of men who have sex with men. Specifically, Higgins and Goldbaum in the late 90s were looking at this in terms of priority areas that they could do focus on HIV. Of course, we were looking beyond just HIV, but in terms of developing our tools, we looked at ethnographic sort of questioning in and around describing the communities, but then also applied sort of a health needs assessment questions as well to determine where interventions could take place. So this came out in three sort of broad categories. One was the actual in-person engagement with organizations and actual members of these populations and communities, doing a lot of work online, but then also venue-based interviews and recruitment as well. So I'll briefly go through some of these. So in-person engagement, the models that we used was sort of using concentric circles away from what we knew. So engaging with our partners first, and then having them refer us on to different organizations and leaders in the communities. And in some ways, the organizations and the leaders act as gatekeepers for the communities or for the populations, in that they could help us describe the populations and talk a little bit about the issues that they were facing, but also act as a way of then introducing us further into these populations, so we could question and sort of discuss and have conversations with the populations themselves. They also acted as interactors, and so especially looking at the businesses that are catered specifically towards gay men, looking at bathhouses and bars and places like that, where where these interactors could really help us to describe some of the populations as well. So, yeah, so we also recruited, besides just like going through the organizations, we also recruited from our website, from advertising in numerous different ways, and to get a real variety of different kinds of guys. And through screening processes, we're able to just sort of, at the beginning at least, kind of like talk about these different populations in different ways. So as I said, online was used for recruitment, but also as a form of online discussion. So we were able to direct people to a sort of online forum where people could discuss questions that we had posited around our 4 objectives. We also, our online component also consisted of looking, as a venue for where guys were meeting each other. And of course, this was very clear, and this has been very clear in the interviews. People bring up the internet as something that's really been a game changer in the last 5 years, and I think we're all sort of aware of that. So how we decided to look at that was we aggregated a list of sites and sort of apps that came out of mostly from the interviews, but just kept adding to that. We tried to assess how they were used by going in and doing some sort of unintrusive observations if we could, depending on the site structure. We also engaged with the owners of the sites to try to have them talk a little bit more about the demographics, especially in Vancouver, of the populations who use them. And then what we did is launch a questionnaire on the more popular sites to just sort of validate some of the hypotheses that we had based on the interviews and based on what we'd found already on the online stuff. Finally, we looked at sex venues, and these venues included, for the most part, parks, rest stops, and other places where men negotiate sex around Vancouver. And also included bathhouses as well, so sort of a more formalized venue. Again, this method was very sort of iterative as well, in that we started with some of the more popular venues, the ones that were coming up in just by talking with guys, and moved there to other locations as well. So as we discussed this with the guys who were there, they talked about different locations, and we tried to get, or at least tried to get a good variety across Metro Vancouver. This one was one of the more challenging approaches because, of course, interviews and doing online is something that we're a little bit more familiar with. Going into sex venues, as far as I know, has been done very, very rarely in at least Vancouver and across Canada. And so developing how we were going to approach this was very important to us, and it was really important that we do it in a very respectful way, and recognizing that we are going into the space of these men, and so trying to be very upfront about what we were doing and why we were there, and how they could that they could walk away as well. And I'm happy to talk a little bit more about that too. At these venues, we were able to talk to gay men, and really a huge variety of different types of guys who use sex venues. So getting into a bit of the response, the project is coming to a close, and so I'm in the process of just sort of gathering all the components of the project together and beginning in the beginning stages of writing the report. In total, I think, if my math serves me, that we've engaged with almost 200 guys in the Lower Mainland in lots of different populations, lots of different demographics. That part has been really, really exciting. When we talk about the online component as well, it's going to be well over 400. We're still actually having some results coming in from the online components as well. Overall, the response has been really very positive, and I think that's one of the virtues of taking this response is that, or this sort of method is that it is a very sort of engaging and empowering method to take with guys in some of the questions that we're asking and how they can determine in how they describe themselves, but also how they determine what health needs they have are. I'll just point out with the response in the sex venue, that was something that we were kind of unsure about, like what the response would be like in that. And it's ended up, that has been one of the, actually the places where we got most of our respondents from. Guys there were just very, very eager to talk and very, very eager to share their stories and engage with the consultants that we had there working. Another thing I'll note here is that this, because HIM, of course, is also a service organization, using these kinds of methods as outreach is something that we were able to experiment a little bit with, and definitely, again, with the sex venue part of it, the guy who was out there was doing a lot of sort of outreach work. He had a lot of experience in sexual health, and there were guys who were asking a lot of questions, and it was great, I think, that he was able to engage with the guys that way as well. So just some final notes, because I know I'm sort of wrapping up on time. The report should be available publicly before the end of the year. This is, I think I just really need to emphasize that this is really only the beginning. Of course, this is a really short consultation, and in the end, it's raising a lot more questions than I think it does answers. And I think it's really also going to, it can sort of lay the foundation for other research that could go on, or other interventions that could happen. But I think the really important thing to note here is the feedback sort of mechanism that we've set up with the community consultation, in that we are feeding the intention, and the whole idea from the beginning is to feed it right back into these communities and populations. Just some other notes, we're identifying a lot of stuff around HIV, but of course other health issues as well. And then I think in the end, this also could have implications for other jurisdictions as well, as we sort of move beyond or move into different ways of engaging with these communities and populations. HIM, I think, again, just reiterate that is really uniquely positioned in Vancouver, because they are an evidence-based organization, to take information like this and apply a lot of the academic knowledge that is out there. And definitely these last 2 days have provided so much additional information that can be used sort of in conjunction with something like this, to then inform service and programming, not just at HIM, but other places too. So that's it. Thank you.
Thank you.